I guess I feel like we should crack on so that we don't run over. There's 18 on. The presenters are here, so maybe we should just go for it. What do you think? Yeah, thumbs up. Okay, I think we'll begin. Tēnā koutou, tēnā koutou, tēnā tātou katoa. Ko Julius Clark taku ingoa. Te rangatira o te kuranahi o te whare wananga o Tamaki. Welcome everybody. My name is Julia Clark and I'm the head of the School of Nursing at the University of Auckland in New Zealand. I'm also the chair of the U21 Nursing and Midwifery Discipline Group, and it is my pleasure to welcome you to our annual meeting. For those of you new to the meeting, we are part of the U21 Health Sciences Group, which was established in the year 2000. The group was created to provide U21 staff and students with a framework for exploring opportunities for global collaboration in research, information exchange, and the sharing of resources across the health sciences sector. I've been chair of the Nursing and Midwifery Group since September 2019, and most of my tenure has been taken up under the restrictions of COVID-19, but our energy and enthusiasm has not been curtailed. To celebrate the Year of the Nurse in 2020, we put on a series of webinars for U21 Nursing and Midwifery members, focused mainly on the COVID-19 pandemic, obviously. These events were very successful, very well attended, and reached many nurses and midwives around the world. Our work in 2021 has focused on the student experience, and to celebrate International Nurses Day on May the 12th this year, we held a Zoom forum for some of our pre-registration students to exchange knowledge and ideas about their healthcare settings. And we've also initiated a postgraduate research community of practice for our research students to meet and share ideas. Our meeting today is a reflection of the care and compassion which is central to our disciplines, and we are the leaders of compassion in healthcare. We are very lucky to have 4 exceptional presentations today, which are diverse and an excellent example of our international collaborations created from this network. But first, what I would like to do, I think it's really important that we use these meetings as an opportunity for networking and getting to know each other. So I thought that we would start with a short update from each university that is represented here before we start with the presentations. The format of the rest of the session will be that we'll have 2 presentations, which are 10 minutes each, and then we'll have an opportunity for questions and some discussion. And then we'll have a further 2 presentations, followed by more time for questions and discussion. Please feel free to use the chat function for any further questions. I will try and keep up with those as we go. But if we start going round, you don't all need to speak individually, because I keep making that mistake and we end up spending the whole 2 hours because everybody speaks. But I just thought I can see Annie there from Birmingham. I just wonder if you could, is anyone else with you?
I don't know if Pat Hibbert has joined. No, it doesn't look like. She was thinking about it. Oh, Alistair's here. In terms of U21, usually Jane Nichol would speak for us about the portfolio of activity, but unfortunately she's away at the moment. I know we've been involved in a lot of projects, and we're particularly involved in the International Day of the Nurse, where our students participated, and that was a wonderful event and really well evaluated. There are a number of individual projects which will be reported, I think, separately that we are involved with. But thank you for asking us to contribute.
Brilliant. Thank you for contributing, Annie. It's great. And Louise, did you want to say hello from Nottingham?
I can say hello from the University of Nottingham, although I'm not in Nottingham. I'm in Melton Mowbray, where the pork pies are made. And
pork pies.
Yeah. So I'm Louise Walker. I'm the lead for global engagement for the School of Health Sciences, and I sit on the U21 Nursing and Midwifery group. I'm a midwife, so there are a few midwives, but it is predominantly nursing. But it's obviously been a very, very difficult year for everybody. We're in the UK, we've had a number of our planned global engagements cancelled, so we're doing most things virtually. I haven't got a great update on things with regards to U21, but what I thought I'd just tell everybody is in 2020 the School of Health Sciences celebrated 30 years of nursing at the University of Nottingham, and again we've ended up having lots of celebrations on that, but unfortunately they've ended up being virtual. But we've put that on, and we've had some great blogs from students who've been there right from the first cohort in 1990. So that's been a great celebration, and a lot of those students are now practicing nurses across the whole world. So it just shows what global connections we've all got. So I'm looking forward. This is my first annual meeting, so I'm looking forward to the presentations and having a virtual meeting with us all. So thank you.
Brilliant, Louise, thank you. For those, we've had a few join us since we started this. We're just doing a little round of the universities really to just have a little sort of introduction. So we're not doing individuals, but yeah, I know a few of you from the university, so if you can just say a little bit about your involvement with U21 so far. So I can see Magnus from Lund.
Hi, Magnus Hamberg from Lund University in Sweden, and when it comes to U21, I've just been involved for a couple of years, since 2018 or 19 or something like that, in Glasgow, and I'm trying to struggle to involve more teachers. Julie attended a teachers meeting at Lund University in June, I think it was, but I can't see anyone else from Lund here, so I guess I'm failed in that one so far. But I'm struggling in my management group to involve the other programs as well on advanced level and midwifery. Otherwise, I've been involved in a project about palliative care that Lisa is running, and I think she will perhaps talk a little bit more about that if she are going to present anything about that. And that pretty much about Lund. I think we're struggling a bit to keep our students right now. I think we've seen at least a temporary dropout at all semesters because of the pandemic. They're struggling to keep their interest and trying to do it online, and they don't really enjoy that. So I don't know about the other universities struggling with same kind of problems, but we're seeing this autumn at least. Okay, thank you.
Thank you, Magnus. Yeah, well, in Auckland at the moment, we're in a level 4 lockdown, and I think, you know, the levels of stress, and for our postgraduate students, a lot of them are having to drop out because they're being called to do vaccinations and swabbing, and you know, attend to the crisis that we're in at the moment. So it's very, very stressful for people. Thank you, Magnus. I can see Peter Lewis from the University of Queensland. Hi, it's nice to see you.
Yeah, good to see you again, Julia, and good to see everyone else as well. So probably since we all last came together, we've got, of course, Sandy McCarthy from you guys over with us at the moment, and she's powerhouse in research. So with the U21 research, I'm doing some work at the moment with Stephen and with Annie, and Lily I can see in here as well. I know Lily's connection can often be poor, so that's probably why she's got her camera off at the moment. And we're doing some stuff around, I won't go into it in too much detail because I know Stephen and Annie are going to be talking about that a little later in the meeting. Probably one of the other things I would be keen to mention is that we put a couple of the students, we put some money aside and paid for their registration to do the U21 Global Learning Partnership, which was run online this year with Nepal. And 3 of the students went and did it. There was another 2 that paid for themselves to do it, and all of them raved about it, said what an amazing experience it was.
Oh, that's great to know.
Yeah, really good to be able to feed that back. And 2 of the students that didn't do it, because we put the funding into nursing, were from social work, and they got just as much out of it. So it was really good that that worked well. And probably the other thing that we've got is we're doing some work with another one of the schools in the health faculty at UQ, and that's around that interprofessional education. And that sits within another group. But so, yeah, it's great to be part of U21. Thank you, Julia.
It's fantastic to have you. And it's great because we've got Karina online. So she's our super duper administrator. So she'll be able to feed that excellent feedback back. So thank you for that. Lovely. And I can see we have Chia Chin from the University of Hong Kong as well. Welcome. Lovely to see you.
Well, thank you, Julia. Lovely to see you too, and lovely to see everyone here. Well, thank you for holding this meeting. I wish we could meet in person, but it's still nice to be able to see everyone here. We have resumed face-to-face teaching here in Hong Kong U, so students are back to campus. So life is back to normal, basically. So I think we are quite fortunate. And also this year we will be holding Hong Kong Nursing Forum on December 8th and 9th. So like last year, I will be happy to reserve a time section for our U21 RPG students seminar if Julia approve and everyone is interested. So I will be more than happy to share more information to you in the near future. So yeah, thank you for having me here, and thank you, Julia.
Oh, thank you very much. Yeah, that was very successful last year. The University of Hong Kong in their annual meeting put on a session for the U21 postgrad research session. It was fantastic. And we did some short 3-minute thesis type presentations, and yeah, it's fantastic. So thank you for that. It's great. It's great for the U21 network to be able to get out and be seen elsewhere. So thank you for that. Who else have we got here? We've got University of Johannesburg. We've got our speaker.
Oh, good morning, colleagues.
Rona,
and thank you so much. Oh, video, sorry. Good morning, colleagues, and thank you for the warm welcome. I'm Roina Ngonyulu. I'm the head of Department of Nursing at the University of Johannesburg. And I'm also an advanced midwife. With me, I'm having my 2 colleagues. As far as I know, Lorato, who's going to present. She's a PhD candidate. And Dr. Mpumi, who joined us this morning. So at UJ, we started a committee of practice of our PhD candidates as lecturers. And our ultimate goal is that moving from the lecturers, we will be including our students so that during our collaboration, we are able to share the research projects that we are doing at UJ and in South Africa in general. So we are happy to be part of the group, and we are looking forward to more collaborations in the future. Thank you.
Fantastic. It's great to have you on board and presenting today. We're looking forward to Lorato presenting to us a bit later. So thank you.
Thank you.
Okay. Now, can I say Yanhu from Fudan?
Hello, colleagues.
Hi.
Very nice to meet in the web and the online. So we are now in Fudan, is all getting back to the semester, and the students and faculty members are going back to the traditional ways of face-to-face teachings and all the academic activities, but still concerned about the progress of COVID-19 in the effect on teaching. And whenever there is cases and everyone is getting very nervous and just worries about the disease, the pandemic. But now I think it's getting better now. And in Fudan, we would very much like to have more opportunities for our students or PhD or master or undergraduate students to share, because these 2 years is no international collaboration, and every student is just asking that when we could go back to the normal exchange with other university nursing students and also faculty members. So we said we were looking forward to the further chance. So would very much like to have a further chance of collaboration in U21. Thank you.
Brilliant. It's lovely to see you. It's great to have you here at the meeting. It's great. Excellent. A couple of others. Pat's now joined us, I see, from Birmingham. Hi, Pat. And Denise is here from University of Melbourne. Hi, Denise. Denise very kindly led our first postgraduate research community of practice meeting back in, when was that, Denise?
A while ago.
Yeah, that's what I think.
Yeah.
So what we're doing is we're literally just doing a sort of a bit of a round the house of each university, really, rather than each individual, because otherwise we'll be here all night. But yeah, so it's just nice to see you guys as well. And I saw Lillian Ferrer from Chile.
Yes, good morning, Julia. It's so good to see you.
Good morning. I think it might be the middle of the night for you, though.
Yeah, a little, but it's so good to see you all. So thank you very much for organizing the meeting. And well, here we are doing a little better in terms of COVID. We have our students back in clinical practice and actually in face-to-face teaching on campus. Being part of U21 has been a wonderful experience for us. We have worked with the University of Auckland, University of Birmingham, University of Hong Kong. We have been from Queensland. Actually, it has been really wonderful to have the opportunity to organize students encounters online during this period and in the past, and we are really looking forward to have students from Nottingham, Lund, Auckland, again here in Chile. We organized the summer university program in the past, and we have done some research work around gender-based violence, and also at the moment we're working on nursing thriving with the leadership of Stephen from Auckland. So really U21 has been a wonderful opportunity to network, and we're really looking forward to have some face-to-face meetings in the near future.
Absolutely. Thank you, Lillian. Great to see you. And I see Fiona Timmins is on from UCD.
Hi.
Nice to see you.
Oh, great to see you. Thank you. I'm new Dean and Head of School of Nursing, Midwifery and Health Systems in University College Dublin. So I've been in position now just for 6 months. So I think this is my second meeting, and I have to apologise. I need to leave at about 9:15, but I'm delighted to be here, and I'm just really kind of finding my feet. I'm just over COVID-19 as well. This is my last day of self-isolation. I'm vaccinated,
so
it's been an unusual couple of years.
Oh,
I'm okay.
Wow.
I'm a bit flat, but I'm okay. I survived.
Oh, well done. Yeah, exactly. You survived. So, oh, well, I hope you get a speedy recovery.
Hopefully get back up running. So in terms of, great to hear about the opening, we're back to face-to-face lectures now for all our undergraduates, and our postgraduate taught is remaining online for the next number of months. And from our faculty's perspective, we're maintaining the online meeting structure for the moment, just to sort of minimize risk. And our numbers are really good. Sorry to hear that the numbers are depleted in other areas. So delighted to be here. Thank you.
It's great to have you all. Is there anyone I've missed? Yay, get me. Excellent. Marvelous. That's a relief. I think we're having a little bit of trouble in the Southern Hemisphere at the moment with COVID, but it is actually really great to hear that the Northern Hemisphere is at least starting to get some sense of normality again and learning to live with it. That's what I think in New Zealand we're most fearful of at the moment. We've got to start getting our heads around the concept that it's going to be in the community, and people are going to have it, and unfortunately people are going to die because we've been so lucky in that we've had so few deaths. So yeah, it's Good to see you all. It's fantastic that you've joined us this evening, and we are right on time. So far, so good. I think we should get on with the presentations now. So it is my great pleasure to introduce Professor Annie Topping from the University of Birmingham and Dr. Stephen Jacobs from the University of Auckland. You're going to spend the next 10 minutes or so, and the title I've got for your presentation is Early Career Nurses. So I will hand over to you guys.
I think Stephen has developed a taped interaction for us, so I think that runs first, doesn't it? But Stephen's in charge.
Thank you, Annie. I was told it had to be pre-recorded, so I pre-recorded. I'm not hugely natural on pre-recording, so you'll have to excuse that. But it's only 7 and a bit minutes long, so there's room for Annie and Lillian and Peter to talk at the end very quickly. So I need to share the screen. I hope you can all see that. I just need to, God, and hello, I'm Stephen Jacobs from the University of Auckland. I'm very pleased to present to you the work that's been done by myself, Annie Topping from Birmingham, Stephen Kavanagh from UC Davis, Lillian Ferrer from Chile, and Peter Lewis from Queensland on early career nurses. We know we have a wicked global problem, which is to do with the retention of registered nurses, early career registered nurses in particular. And we could focus on the question, why do early career registered nurses leave? But we have a lot of answers to that already. What we've been interested in focusing on is what can we all do to create education and management systems that support early career nurses to thrive and to stay in the profession. Last year, U21 funded us to do the Vision Thrive study, which was to work with final year students, basically on a proof of concept, looking at how do we develop a workplace that enables thriving early career registered nurses. The idea was to undertake a small multi-centre theoretically driven study to identify what student nurses wanted, what they perceived will enable them to flourish in the workplace on registration. We wanted to test the feasibility of an appreciative inquiry approach and a co-design approach, and we wanted then to be able to inform other U21 schools of nursing of outcomes and encourage collaboration in the next steps. Progress has been hindered by the COVID epidemic, but we have made progress. We got ethical approval in Auckland and Chile, and it's been sought in Birmingham. Data collection is complete in Auckland. There's been progress with data collection in Chile, and data collection is planned in Birmingham in October. Our research collaboration expanded from 3 to include Queensland and UC Davis. The 5 of us put in a grant, which was successful. And we've all been talking about getting PhD students engaged for this year and next year. There is a PhD student starting soon in Birmingham. There are 2 students involved in Chile that are thinking about it and working, finishing masters, and will start PhDs next year. And there are 2 others that we know of in Auckland who may join in this work next year. The key thing at the moment that's coming out of this, an emergent outcome, is that we've realised that we need to establish an early career nurse support learning and research network. We can't afford to get locked down in a research project which won't report outcomes for a period of time, especially in this sort of context where it's very hard to do research and things get delayed a lot. So we are establishing a network of U21 schools who are willing to learn together, to test things, to implement things at scale, to drive meaningful and measurable progress to facilitate early career nurses thriving at work. The purpose of this is to increase the successful transition of nursing graduates to the workforce through engaging with students, educators and health providers. We want to improve the retention of early career nurses, a problem that we are all facing. The long-term purpose is to facilitate the development and evaluation of education and management systems across all the schools of nursing involved, so we can identify what does really work to successfully support early career nurses. We will take a positive organisational scholarship approach, which means we want to identify what's working well and what's needed to work even better. We want to take a longitudinal approach, looking at basically over time, what are the changes over time, using the occupational hardiness questionnaire, which was developed with nurses, to look at the types of nurses and whether there are different sorts of nurses who need different sorts of supports because they have different approaches to occupational hardiness. We want to use co-design, experience-based co-design, getting early career nurses, undergraduate nurses, managers, educators, all talking together and sharing information that will support the development of management and education systems. We want to evaluate through the ongoing quality improvement, and we want to integrate data analysis site by site and by centre so that we're comparing across country. So what do we want to achieve with this early career nurse support learning and research network? We want the schools of nursing involved in H21, the nursing and midwifery schools, to commit to finding systemic solutions to improving rates of nurse and midwifery nutrition. We want to facilitate the sharing of generated evidence-based co-designed leadership practices and behaviours so people can learn from each other. We want to learn by identifying, evaluating, sharing the actionable steps that people have taken to achieve goals. We want to have a meaningful and measurable impact on workplace systems that can facilitate retention. We want to contribute, of course, to the body of knowledge about comprehensive, systemic and replicable changes. We want to establish a data repository so that people can access data from around the world that's based on this research or these approaches, so that they can go somewhere to learn from what other people have done and share things. And we want to establish a community of researchers, including a community of postgraduate research students. What does this mean in practice? What will we actually have? At the moment, the idea is to have monthly meetings of all the schools of nursing that are involved to basically talk about things, talk about what they're doing, what's working for them, etc., share ideas. But we also want to focus things quite deliberately at times, so that sometimes those regular monthly meetings might be a workshop which is focused on a particular aspect where people are talking about some particular approach they're taking either to education or to the management of early career nurses, and where actions can be decided on that the schools of nursing that are willing will go and try them over the next 3-month period. We wanted to develop action plans that everyone's agreed on, what needs to be done next, who's going to do it, how are we going to support that. We're looking at the possibility of having joint supervision of the postgraduate students and postgraduate research. And if we can't have joint supervision, at least we could have advisors from other universities connecting so that we're basically forming a collective. Coaching calls, we might establish meetings where we basically ask experts to come and do some coaching of people who have raised a certain issue and want to present what they're doing and have people talk about it and help them be coached about that. We're looking at collaborative outputs. One idea is that schools of nursing who wish to be a part of this network register in the network, and therefore anything that is published, any output that's put out there, basically the organisation has the Early Career Nurse Support Learning and Research Network attributed to, and so we gain a reputation that increases the value of the outputs. And we will need, of course, the agreements around data sharing, because there are certain international protocols that we need about privacy, etc. So the idea is to build a platform of people working together to resolve what is a very difficult issue. But where if we work together and learn from each other, we can actually find ways forward, and new ways forward will emerge. So I hope you will join us in this endeavour.
Thank you for watching that. Now, Annie, Lillian, Peter, would you like to add anything?
No, I think, Stephen, you covered all the issues. The question, I suppose, for us is really about, do others want to join the network, isn't it, ultimately?
Yes.
Yes, I agree with Annie. Actually, you covered pretty much everything, Stephen. And I think that the value mainly of doing this is that through the work of this network, and hopefully by having more partners, as Annie was saying, we really can make a difference in terms of having more nurses on board for more time doing nursing work. So I think that has been the focus for us, and we really look forward to have this network to support early career nurses, but hopefully in the future also to have this network of support among ourselves too.
And possibly one of the things that didn't come across is that all of us are engaging with practice partners or service providers in different ways. I mean, Stephen didn't mention the amazing gamut of providers, community and secondary care. Here in Birmingham, it's with a large NHS organisation. So we're really trying to, it's not about schools of nursing alone, it's schools of nursing with our graduates, with service providers who are trying to tackle the problem rather than describe it yet again.
Can I also just add that I do have a little bit of funding and a research assistant who will help me in terms of establishing and managing this network for a period of time. So it'd be great to have people join us to get the energy going as fast as possible. Thank you, Julia, who's looking impatient now.
No, not at all. I'm nodding. Honestly, Fiona's got a question for you.
Oh, thank you. Hi, Annie. Great to see you again. Thank you for a wonderful presentation and a wonderful initiative. I just am wondering, and maybe I missed it now, apologies, I might have drifted off. In terms of the early career research or nurse support, are you thinking around the PhD and that level, or clinical practice, or both?
We're really talking about clinical practice, not clinical academic careers. But I mean, in some ways, clinical academic careers, one could argue, is one of the ways of keeping talent in the profession.
Yeah, I mean, that's really where my interest would lie in terms of, we're having a situation at the moment, which I think is reflected internationally, where we don't really have faculty for the future. And the PhD is not necessarily seen as a sort of a career move for the graduate nurse. And I think we need to look at that and encourage some type of career pathway that could be both. Value your PhD, and that I think we're short-sighted in the profession. We've gone so far with our professional development in the last 25, 30 years in this part of Europe, and now it's stopped short of the PhD.
I think it's very interesting you raised that point, Fiona. Sorry to jump
in,
take over. Because it is very interesting, because I'm involved in clinical academic careers in my other job. And one of the things that I see is an increasing lack of interest in a PhD, and the problem that creates in schools of nursing for staff candidates who are doing their PhDs part-time in what is a very high demand, burdensome delivery of education. And it takes time, and also we're not necessarily tackling clinical research. We're moving more and more to educational research. Again, it seems like we've had a reversal of the focus on clinical research, and there does seem to be a need to develop early career nurses into thinking about their future education. I mean, I would agree, we've got a problem with the greying faculty everywhere, or the ill-prepared faculty coming in very junior.
That could be one of the things that is put forward as part of what we focus on, because we're not determining exactly what's going to be done. We're basically saying, let's open up a place where people can have the conversations and work together to identify what's the issue they want to focus on. For us at the moment, it's been the education of what happens in the undergraduate program, how people transition across to being an actual nurse in the first 5 years of nursing. But you've raised another aspect of the early career nurses who actually would be very good academics as well, and how do we support them? We're trying to do that. Yeah, we're trying to do that slightly by inviting early career nurses to come in and do a PhD on the issue of supporting early career nurses at the moment.
Thank you.
Some excellent comments in the chat. Louise Karukan-Wood has just said a student forum today in New Zealand, 2 of the 7 students were seeking information about PhD and doctorates. So the nurses of tomorrow may demand it. Thanks for that, Louise. Magnus, you were talking about, you've been thinking about this for a while, and talked to Stephen about it in Glasgow, and yeah, the pandemic has sent us all off track a bit, but I think, you know, it's something that we might want to take forward as this group. Might be an excellent project. I'm very keen from a New Zealand perspective to look at clinical academic careers as well. So, okay, that was good discussion. After that, we will move on to the next presentation, if that's all right. We're very lucky to have Mrs. Lorato Matshaka, who's a PhD student from the University of Johannesburg, who is going to talk to us now for the next 10 minutes on the impact of COVID-19 on student nurses and nursing academics at higher education institutions in South Africa. Thank you.
Thank you so much. Let me just take this opportunity to just greet and to appreciate and the opportunity that we've given to share our study. If I can ask that I'll be given permission to share my slides.
I think you already have the permission.
Okay, cool. Let me do so. Can I get confirmation if you can see the slides?
Yeah, it's okay.
Cool, thank you. So as introduced, my name is Lerato, and in this study, I'm working together with Prof. Roina Ngunyulu and Dr. Nompumelelo Nchimila. And our study is entitled The Impact of COVID-19 on Student Nurses and Nursing Academics at Higher Education Institution in South Africa. So this is an ongoing study, and we have actually started collecting data. We started collecting data last year towards end of November, but we are still obviously in the process of entering and gaining entry into other institutions. So just to share, I'm hoping to cover the background of the study and just to share the purpose and the objectives, and I'll obviously share the significance of the study. So coronavirus was declared a pandemic and a global health emergency by the World Health Organization. And South Africa on its own had recorded their first case in March 2020. And after the first case, cases kept on increasing to a point where the country went into a hard lockdown. And due to the hard lockdown, if many can confirm, there wasn't, we were not able to do face-to-face interactions with the students. And therefore teaching and learning and assessments moved to an online platform, but some institutions opted for a blended learning approach, depending on the type of program that was offered by the institution. So nursing programs, as we can agree, are different from other educational programs. Students are expected to cover a few hours in clinical, and they are expected to cover a few hours in simulation lab and in class. And 80% of work integrated learning should be done in an accredited clinical setting under supervision. In South Africa, we have the South African Nursing Council, which expects the students to be at an accredited clinical institution. So for the undergraduate students, it was a bit of a challenge to have our students at the institution at the time during the hard lockdown. But the postgraduate and the post-basic student nurses, which are born from different eras, they form part of the workforce in hospitals in South Africa. So they were already in hospitals, and they were actually undergoing such a lot of pressure because they were expected to be at work at the time, and they couldn't focus on their studies. So their studies actually suffered. And because of this, they were also struggling with the online platform. You know, some of them were born before technology. So it was a struggle for them to be able to continue, and some of them are dropped off. So nursing academics as well at the South African institutions are also from different eras, and some of them are born before technology. So some of them were also struggling with this online platform of teaching and learning. And just in addition, students in general that are from South Africa come from different backgrounds. Some come from really poor backgrounds, some come from well-off backgrounds. So they were able to still continue learning and are thriving with the online platform, but some really struggled. Institutions did try to support the students by giving them data and smart devices to be able to continue with their learning. But some of these students, because they are from remote areas, like rural areas where there's no network coverage, they still struggled to still continue with their learning. And some of them, it may not just have been network coverage. Some of them come from families where they stay maybe a lot, like 10 in a 2-room house. So there's not really much room for them to be able, or conducive environment for them to study. So universities in general in South Africa were not ready for a complete online teaching. And we know that coronavirus does have a significant impact. I mean, some people are still suffering now, families are suffering, and students are still suffering this impact that the coronavirus has brought among people. So in South Africa, we realized that there's a limited data on effects of the pandemic on student nurses and nursing academics. Therefore, we decided to take it upon ourselves to do the study, to be able to find out what are the impacts that this virus has on people. So the purpose of the study was to investigate and compare the impact of coronavirus on student nurses and nursing academics in relation to teaching and learning, in order for us to provide recommendations on how the delivery of quality nursing education and training can be facilitated. So we had a few objectives. We wanted to determine the psychological, educational, socioeconomic impact of the coronavirus on student nurses and nursing academics in relation to nursing education, teaching, and learning. And we also wanted to compare amongst the 5 higher education institutions, how are the student nurses, how are the nursing academics taking this impact that has been brought upon them by the virus. And lastly, we wanted to provide recommendations on how we can actually contribute to having quality nursing education provided during the coronavirus pandemic, or any other pandemic for that matter, because there's no telling what pandemic will come after this one. And the question was, what is the impact of coronavirus on student nurses and nursing academics in relation to teaching and learning? We followed a quantitative, descriptive, and comparative study design, survey design, which is contextual in nature for us to be able to get to the results which we're looking for. And we're looking at using student nurses, including undergraduate, post-basic, and postgraduate nurses at the 5 higher education institutions in South Africa. And we are using a stratified random sampling method. For collection of data, we're looking at computer software package, SurveyMonkey, an online survey. And we are using a tool or tools that have been developed. So we had to ask for permission before we can use the tools. So the student nurses will need 30 minutes to be able to complete the surveys. And we are going to, or we have already started using university management systems to be able to gain entry into the institution. And for analysis, we are going to use descriptive and inferential statistics. And the descriptive statements in the surveys will be analyzed and coded in consultation with the independent coder. Like I said, we've already started collecting data, so we have received ethical clearance from the host university. We have received permission to conduct the study from the host university, and we have gained entry with the relevant gatekeepers. And we have sent the letters of permission to the other institutions, and we're still waiting for their responses. Hopefully, we can be able to gain entry. And participation in the study will be voluntary. We will not force anybody to participate in any way. And participants will be allowed to withdraw from the study, but they will have to do that before submitting the survey because it's anonymous in nature. And hopefully when we are done with our results, we will be able to recommend and refer the students when necessary and the nursing academics. And we're also hoping to come up with an improved plan on how we can use online teaching, which is relevant to student nurses and the nursing academics. And we hope that once we are done with our study, we can be able to, maybe in the next meeting, share our results with the group. Thank you so much. Any questions?
Fantastic. Thank you very much.
Cool.
So at this point, from what you know, have many of your nurses been delayed in graduating because of COVID?
Yeah, so far we have already received requests where students are asking for extension for their studies, because like I said, some of them are actually part of the workforce. So you can imagine the pressure that was on them because of this of coronavirus. So they had to actually put more work, and some of them, because some of the staff were dying, so they had to actually be there and they couldn't have much time for their studies. So there are cases where they've asked for extension. And the undergraduate student nurses, which I didn't mention, have also not covered the required amount of hours. So they will need an extension, yeah.
And have your equivalent, your nursing council there, have they been very flexible? Have they done anything to allow the undergraduate nurses to sit their exams differently or do less clinical hours or anything?
No. They are allowed. They are not really allowed to do less hours. They are required to cover the amount of hours. So institutions will have to plan on how to get their students to cover the required hours. So they won't be lenient or anything.
But can I raise a...
You're right there, Annie?
Yeah, I was going to ask a question, which is something that came up with some of our students, is because all their learning had been online, they were sort of learning in the bedroom and lying on their bed and, you know, not very physical. And when they finally got into practice, they were quite deconditioned. Did you find that they found practice exhausting in a way that previously students didn't, which for us was quite fascinating?
I don't know if Prof. Ngunyulu wants to take this one. I see her hand is up. But just to say, yes, students are actually not just exhausted, they're also fearing for their lives. You know, they're very demotivated to go into clinical practice because they worry that they are now used to cover the staff shortage. So they feel that they don't really have much time for their studies. And yeah, that's what we've experienced. Prof. Ngunyulu, I saw you.
Thank you so much. Thank you, Lorato, for the presentation. Students, both undergraduate and postgraduate, were really affected because in the first place, it was just a surprise to South Africa. For most of the pandemic, we were still blessed. We were comfortable. We were just hearing from the news that this happened in China, this happened, but last year it came to us as a surprise. So it affected them really seriously. The first thing for both of them, as they are human beings, they are not immune to the vaccine. There were some were candidates were tested positive. Some the relatives were affected seriously. Some lost their loved ones. So it affected them really seriously. For the undergraduate, for the postgraduate, they were frontliners. They were affected. We had to, from the university side, we had to request extension of their training. The last group was in June this year. That's where we finalized their marks. So it really affected both sides. With the nursing council 1,200 hours. they don't care whether pandemic or not. So this is what happened, and we are hoping to get more from them because this is from our observation. So from the results, really, we are hoping to get more that we'll be sharing with the group next time. Thank you.
Excellent. Thank you very much. JP Leach is in the house. Hello.
Thanks very much, Julia. In the house. So I also, since anyone said that, thank you. Listen, Lerato, thank you very much for describing that study. That sounds really important. I think we in Glasgow have perhaps not anticipated quite the effect on our students as we've seen. I put a question in the chat there. I think it's become apparent that those in a younger age group, 16 to 24, are much more affected in terms of their mental health by this pandemic. I wonder, given with the demographics of the students you're going to target, will there be enough in the number of mature students to work out if that's an important variable here?
Please come again with the question. I missed it.
Oh, sorry. Will there be enough older students, mature students, to see if their reaction to the pandemic has been different from the younger students who've perhaps just arrived fresh from school?
Oh, okay.
Do you want
Can I take this one, Prof? Yeah. Yes. So, like with our respondents, we have undergraduate students, and their ages range between 18 and 24, some 29.
Oh, right. Okay. Right.
So we also have post-basic students, and these are like professional nurses, right? And they're old, like some of them are like 30, 40, 50. So
that's
they
still quite young, Lerato. That's
really okay. So there will be that chance for us to be able to see the difference on how the virus impacted both. Yeah, there will be, definitely.
An important question. Thank you, Lerato. That's excellent. Thank you.
Thank you.
Louise, got your hand up?
Yes, I couldn't find a hand up emoji. I could only have a clappy and a thumbs up. So thank you. Yeah, no, I think this is a great study, and I know the impact it's had on our students here in the UK and around the University of Nottingham. I think the impact it's had on the academics is another really important point to raise, with staff going back into practice to help out with the workforce, not only with nursing but with vaccinations and things, and also with the increasing support that academics have need to give their students. And I think, from a very personal perspective as a manager, the staff have needed an awful lot of support because of what support they're giving students, and it's had a massive impact on our workforce as well. Thank you.
Absolutely. There's some great comments in the chat. Annie brought up about mental health among the younger students was very apparent. She worries about the new grads of 2021, absolutely. And I'd forgotten that they would have had the debacle around their A-level results as well. So they're already coming in to nursing with those anxieties and those experiences. You've got a student here from Swaziland who the virtual meetings with supervisors. Yeah, that makes it very hard, and trying to keep people engaged with the Zoom and the online. We're seeing it at the moment. And Annie, again, levels of staff mental health issues, absolutely, the knock-on effect. Fantastic. Thank you very much for an excellent presentation. Have we got, so there are still some hands up. Nompumelelo, did you want to ask a question?
Yes, no, I'm part of the team. I just wanted to say an observation from when we are still doing the data collection is that the surveys are actually coming quite slow. And I think as much as COVID-19 is important, people are also drained by talking about it. So I think that is one challenge that we are experiencing that we need to actually remind people to keep on completing the surveys. So it's just an observation from the study.
Brilliant, thank you. It's an excellent study. Thank you very much. Okay, well, it feels like we're having sort of the discussion after each presentation. We were going to kind of have a break, but I feel like we've got a good flow happening. So I think we'll just keep going, if that's all right with everybody. I'm trying to keep up with the chat as well. Okay, so we'll go to presentation number 3 now. And I think I saw Alistair Hewison join us at one point, but he's from the University of Birmingham, and we've got Dr. Gigi Lim from the University of Auckland, who are going to present now on compassionate leadership in healthcare, an international study of the experience of health professionals. I think this is recorded, isn't it? So Alejandro might just, there we go.
Great. Here we go. Let me know if the volume is all right.
Good morning. My name is Alistair Thielsen. I'm an honorary reader in the School of Nursing at the University of Birmingham. Thank you very much for the opportunity to share some of our work with you. I'm presenting on behalf of the team, which also includes Ian Snelling from the University of Birmingham, Gigi Lim from the University of Auckland, New Zealand, and Mary Bismarck and Natalie Martinek from the University of Melbourne. In the 10 minutes that we have available, I hope to provide some background to explain the origins of and motivation for the project, present a couple of recent models of compassionate leadership that have been developed that inform the work, then summarise the project and share some of the emerging findings with you. There's extensive evidence that supporting staff is vital to staff wellbeing and patient outcomes. So if we're to deliver compassionate care, high levels of staff support are required. However, sadly, there's been significant failures in healthcare, particularly in England, arising in part from a lack of support, and in many of these reports listed here, the absence of effective leadership, and in some cases nursing leadership, has been identified and singled out as a particular cause of the problems. These issues have been thrown into sharp relief by the global pandemic. And if we add in the global staff shortage, the need for effective leadership in healthcare to make best use of the limited and pressurised resources becomes much clearer. And of late, emphasis has been given to a particular type of leadership. Initiatives in the 3 countries, the 3 partner countries for this study, reflect this. So in England, there's been a lot of work conducted by the King's Fund, which we'll talk about in a moment, but you can see the sort of statements that have been made there, that compassionate leadership is essential for the UK, for the future of the UK's health and social care. The Hearts in Healthcare movement, initiated by Robin Youngson in New Zealand, and the work of Mary Freer and her Compassion Labs, reflected there in that statement. The world is asking for compassion, courage and wisdom. So we're sort of in a different environment where people are looking to compassion and compassionate leadership as a way of dealing with some of the challenges we face. So although compassion is widely discussed in healthcare, there's perhaps surprisingly limited empirical understanding of what it actually means, and the need for more research in this area has been identified, and that slide just summarises a recent systematic review. However, going through some of the work that has been conducted, some of the research and some of the discursive analytical papers, a number of common areas characterise compassion. So we get statements about being empathic, caring, the importance of communication, this issue of connecting and relating with people in a genuine way, and working with patients is seen to be part of compassion. importance of having a meaningful connection, and again the number of attributes that are required for caring, and separating that out from what compassion actually is gets a bit difficult, and you can end up with a very long list. But there is this notion that the central to it is a recognition of suffering, and feeling and recognizing that suffering and then doing something about it, encouraging or initiating a response in a person, a carer, to do something about it. And this has an emotional resonance as identified there. So although there's been some work about compassion, we're still in relatively early stages in terms of its theoretical and empirical development. And then if we think about that in the context of compassionate leadership, which is an even more recent term, there's even less evidence. Now we've done some work exploring this, and this just reflects that, how compassionate leadership has been characterised in some organisations. That's a project we did in the West Midlands of England, and some work we did directly with the NHS about compassion. And in my field, palliative and end-of-life care, did a small project about compassionate leadership, getting the views of a range of staff working in palliative and end-of-life care. And out of that came, recognition of the importance of theory if we're going to advance research in this area. So I'm just going to briefly reference a couple of models that have been developed here. The work of Michael West and colleagues, funded by the King's Fund, about compassionate leadership and relating it to these four elements and the actions that follow from that to try and make sense of it. And a European model funded by the European Union, which centres on cultural competence and combining that with compassionate leadership. And you can see the aims of what the aims of that project. And it's primarily an educational focus. So what can we do? It's a conceptual map for potential content healthcare trainers. So it's how do we train people to be culturally competent, compassionate leaders. But we felt there was something a bit more fundamental to address. That's just the model there. In terms of what does it actually mean to people? So the valuable work's been done, but it needs further exploration. So we set out to conduct this comparative exploratory study with health professionals in 3 countries: England, New Zealand and Australia. So it's a qualitative explorative study. We've conducted 25 semi-structured interviews, and we're in the process of the thematic analysis. You can see the duration of the interviews and the sample there. 21 of the respondents were women and 4 were men. So in terms of emerging findings, all but 4 of the participants had heard of the term compassionate leadership. Didn't always have a more detailed understanding of what that meant, but they'd heard the term. Junior staff focused on the need for support and what they expected from a leader in terms of clinical expertise. Although we tried to sample more junior staff because of COVID and recruitment difficulties, we did include some experienced staff, and they offered insights on how leaders need to attend to the needs of staff. Examples of poor leadership were given extensively to report the experience of the absence of compassionate leadership. And we, were presented with long lists of attributes and the qualities required, consistent with the theoretical accounts presented earlier. So the same sort of terms and words were used. Great emphasis given to this need for respect, and communication and the need to listen was central to all of the accounts. And just going to present some of the some data extracts which just bring some of this alive. So this is a RN's characterisation of what compassionate leadership is, or how a compassionate leadership acted. She asked us what was going on in our lives, was able to support and help us as much as she could within her role, and I think that person probably helped me make me what I am today. So, you know, big impact there. That's what a compassionate leader does. It sets the culture. It's very important in terms of how that person operates, a compassionate leader. Clearly it's challenging. You know, there were some questions as to whether this call for compassionate leadership was realistic. You know, is it compatible with some of the structural constraints and the challenges that colleagues face in clinical settings? As one of them said, it's all well and good for us to kind of talk about the importance of being compassionate, being kind and looking after people, but when you're absolutely exhausted and completely busy, you don't have time to go to the bathroom, it's really hard to be compassionate. So, compassionate leadership is a nascent area of theorising and research. We're hopeful that our current study will be a contribution to the development in this area, grounded in the experience of practitioners, but clearly still some way to go. This is work in progress. We're working through the analysis. However, you know, we don't have to wait for prescription and guidance. We can learn more about it and learn more about how to achieve it, but we can make moves in that direction in our everyday interactions with colleagues. Thank you for your attention, and myself and Gigi will be happy to take questions and discuss things further. I've included, you know, a huge amount of reference material in case people are interested in following any of this up. So thanks again.
Fantastic, Alistair. Thank you. Did you and Gigi want to add anything more to the presentation?
Not from my end, Alistair. Do you want to add? I don't know if you're here. I'm sure you're here.
Yeah, I'm here.
Oh, here he is. Hello there.
Hi, morning. No, I guess just with that final point there, I'd echo a comment once made by Stephen Harrison that the extensive references are serving somewhat like a lamppost to a drunk, more in an effort of support than illumination. So apologies for that, but I do tend to rely on that rather heavily. So yeah, it's been an interesting study and a challenging one, like a number of people have mentioned in the COVID environment. But it's interesting hearing the first presentation and then the work with the difficulty students are experiencing, because the junior members of staff we interviewed very much focused on their experience and their postgraduate education and the amount of support that they get in practice. And that was really how they formed their ideas about what a leader should do and what compassionate leadership is, the link with the amount of support they get in their practice. So that's going to be quite a strong theme of what we put in the final report.
I think it's interesting about the qualities that were highlighted, I suppose, and Alistair put that in there and talk about, you know, many of them talk about respect and being non-judgmental, you know, leadership. They see leaders who are compassionate if they show respect, and that's how they see that if they role model that, they tend to also role model that with their own patients and their own staff. But there's also a lot of things done on compassionate leadership, really, around looking at self-compassion as well, you know, and we have a lot of studies around how nurses can be more compassionate to patients if they also show self-compassion for themselves. So how to deal with distress, you know, in times of pandemic, for example. I think there's a lot of that around, you know, showing self-compassion of yourself as well allows you to emit compassion to other people and to lead in a more compassionate way. I suppose we will open for questions maybe then.
Absolutely. I was going to dive in there initially around compassion fatigue. I noticed that quote from the doctor said, you know, but when you're really busy and, you know, it's difficult to is there even a place for compassionate leadership when everybody has compassion fatigue, I suppose?
Yeah, I mean, I think the the thing that isn't picked up very strongly in what we've presented there is the importance of the context and the organisational culture. In that if the setting isn't right and the levels of support aren't right, you can't expect this to happen. And I wouldn't want this to be a sort of a wholly negative thing in terms of it's really, really, really difficult, but which indeed it is. But I know in a number of organisations, Annie may want to comment on this. I know in the big trust that she links with in Birmingham, they put a lot of work into putting staff support in place, and indeed have got a head in the trust who oversees that. So I think there are a lot of efforts that have gone into supporting staff, but the COVID-19 pressures and just the normal waiting list pressures and the staff shortage, which was referred to in the first presentation, really create huge pressures. So I think there are indeed elements of compassion fatigue, but there is recognition of it and efforts underway to try and deal with it.
Yeah, I mean, I would agree, Alistair, when you mentioned the big trust I'm involved with, but I mean, one of the big issues is with COVID is that the let-up hasn't gone away. And we now have the huge backlog of healthcare in the UK, and I'm sure other countries are very similar. Our cancer backlog is enormous, our elective surgery backlog. And so staff have got no opportunity to regenerate or get any of their reserves filled up again in order to fight the onslaught, as it were. So I think we've got a staff who are very depleted anyway, and that is creating real challenges. I mean, for me, I found a really interesting thing. We've recently put some adverts out which are entry-level posts in higher education, and the number of applicants for intensive care are phenomenal, which suggests people are wanting to leave intensive care to come to what they see as lighter work.
Very interesting. Rowena.
Okay, thank you so much for the excellent presentation about compassion. I just want to happily announce that I'm the mentee for Prof. Rina Papadopoulos, who's the champion for this compassion. We are writing, we are doing projects together, and we are publishing together. So I'm happy to hear the team that is presenting today. And this is a very important a topic or issue that we need to focus on worldwide, from both service health facilities and teaching departments, where from the top management, the lecturers need a compassionate manager, the students need a compassionate lecturer, so that they are able to adapt to nursing within this COVID era. Also in the hospitals, if we have compassionate managers, all the nurses will be able to provide compassionate care to the patients and will be able to achieve our goals and have positive outcomes and achieve our sustainable development goals and try to save money by avoiding negligent issues that we had with our different nursing councils. So thank you so much. I'm very grateful for the presentation. Thank you.
Brilliant. Thank you for that. Lorna, hello.
Hello, nice to see you, Alistair. Thank you for that presentation. It was really interesting and really important. I work primarily with year one undergraduate pre-registration nurses. And I just want to say that over the last year, particularly, students have come back from practice, sometimes working in really stressed environments and feeling that maybe they have lacked some of the guidance that they've needed. And one of the things that we talk to them on a one-to-one about is their role in being compassionate leaders and embedding those skills early on, that they have an equal responsibility when you think of the framework around compassionate leadership in terms of belonging and contribution, that they have a role to play, and hopefully we can support them and empower them to help contribute to team well-being, to taking a responsibility for other members of the team's well-being. And I've talked to students about having those one-to-one conversations when they've said that, oh, my practice assessor seemed stressed and I didn't want to ask them about that, that actually it is okay for them to say, are you okay? You know, can I help you with anything? And actually start demonstrating those skills really, really early on.
That's a good one. Yeah. But do we even teach it? I think, do we teach do we teach compassionate science? Do we, or do we just, is that, you know, is that inclusive in what we do rather than, is it explicit? Do we just do it because we're nurses, we care? Or is there such a thing as compassionate science? That's what I've always wondered. Sorry, I think there was a Louise.
That's great. Louise.
Kia ora, thank you for a fantastic presentation. I'm interested in nurse health and nurse health literacy as part of my PhD topic. And I'm just wondering, in terms of the speakers, do you think the emotional demand of caring or the emotional demand of nursing is a workplace stressor, is like an occupational hazard?
Yeah, absolutely. I mean,
yes,
some of the work that
good question.
Prompted me to be interested in this was work I did with my colleague Yvonne Sawbridge, where we used to run a whole series of workshops with staff looking at the management of the emotional labour of nursing. And the way that Yvonne characterised it was, you know, hard hats are not just for builders. So that was the sort of the tagline in terms of, if you work on a building site, you have to wear a hard hat because something might fall on your head. But because of the, in nursing, with the emotional demands and the pressures that are put on people, there isn't really anything formally that would equate to that. We do it for physical health, you know, so we don't force people to lift anymore. You know, we have a whole range of lifting aids, but we haven't kept pace in terms of the emotional and psychological care. So that was a sort of a thing that fed into this work as well. So whether we're jumping too quickly to compassionate leadership as, you know, the latest panacea and think, oh, well, if only we do that, everything will be right. Clearly not. There's the attention to the points that you've raised. The points that Lorna made were that came out very strongly in the work as well, because if you've got effective teams and you've got, you know, teams that are well managed and supportive, doing the sort of things that Lorna alluded to, you know, is there then the need for this other stuff? But clearly teamwork is linked very closely with effective leadership. So all of these things are in mesh. But yeah, I mean, from your basic point, the sort of the emotional health of people can suffer. And, you know, we've all heard the tales of people dealing with a crisis, you know, stemming some bleeding, dealing with a crisis, and they just go home and they sit on their own in the bath with a glass of wine, and that's how they cope with it. You know, we have very good debrief mechanisms in place for major emergencies, but that day-to-day cumulative grind, we're perhaps not quite so good at. Again, I don't want to be wholly negative. There's things that have gone on. We like to think that some of the work we did in our workshops and dealing with mindfulness have had an impact, but there's still a lot to do. Thank you for the question.
Thank you for your answer, because there's some really strong alignment across all the presentations. So thank you for your presentation.
Thank you, Louise. Couple of comments. Lorna's written, proactive strategies to manage nurses' wellbeing and good mental health needs to be embedded within their education. Absolutely. And then Annie's added, hang on. But is there something not merely to teach it, but to facilitate habituation of good behaviours that preference self-compassion and compassionate leadership? And then Lisa Stewart from University of Auckland's added, we have started offering wellbeing sessions twice a week for our Year 2 students. Lisa, you wouldn't mind
sharing
that? What did the wellbeing sessions contain?
So it's twice a week before class. So they do some mindfulness exercises and things like that.
Cool.
Yeah. Yeah. So yeah, Jackie Williams is leading it. So I just know that it's happening. I don't know the full details about it.
No. But again, you know, Alistair goes on to talk about role modelling. Was a strong theme in the data.
Yep. And I think, and again, I think that the students have been really responsive to it as well. So actually, they're quite engaged with it.
Well, certainly I remember a couple of years ago within the Faculty of Medical and Health Sciences, we started having our wellbeing sessions, which were very well received from staff, yoga and all, you know, real practical things that people can do to feel better. Lorna, did you want to add something?
Yes, it was just to add to that, Lisa, about embedding actual opportunities to practice strategies to manage health and wellbeing. So a few of the things that we do at the University of Birmingham, and they have a module called Health and Wellbeing in Year 1, which is looking at public health. But one of the learning outcomes is around how to maintain your own health and wellbeing. So we embed mindful moments into all taught sessions. So they get to practice a range of things that might appeal to a range of people's needs. So that might be breathing exercises, gratitude exercises, stretching during a session, particularly with online learning where students are sat in front of a computer. When our new students start next week, they're going to do some talking and some craft activities to help with socialisation and hopefully introduce them to some alternative strategies for wellbeing. But yeah, the students respond really positively. I often get emails to say, oh, I'm loving the mindful moments, we're collecting them. And then when they come back from practice, we do debrief and reflective sessions with them as well. So yeah, it's great to hear that this work's going on across the board, because the more practice they can be as students, hopefully they can take those into their careers with them.
I love this mindful moment. Excellent.
Yeah.
Thank you, Lorna. Stephen.
Yes, I just wanted to add that I think all that stuff's really, really important. But one of the things I've figured out is that one of the problems is the transition from wonderful undergrad programs to the reality of practice in organisations that perhaps are not so wonderful. And so there's a whole part of the organisational psychology part, the positive organisational approach, the thing around what are organisations doing to support people. The job demands resource model suggests that the emotional aspects of this sort of work, there's the patient demands that are actually what nurses want to have, because they want to support people. But then there's the emotional shit that they have to put up with, to put it bluntly, which is to do with the difficult management, being put on shifts that are overwhelming, a whole lot of things that happen to them that are actually very difficult to cope with. So I think one of the things we need to look at is the teaching that goes on in the undergrad programs that creates a whole group of students that are wonderfully prepared, but then they can get overwhelmed by the reality of the life that they go into. So we need to also work on the way organisations support nurses, not just in their mindfulness teaching and other things, but also what is their rostering like? What are they demanding of people? Are they providing enough support? Are their students actually getting any time off, or are they being called to come back? I mean, their first year students, are they being called to come back to work? And so they're working lots of overtime. Are they finding that the second year nurse and the senior nurse on shift? All those things that actually overwhelm people, even though they could be very good nurses, and so they leave because they're overwhelmed.
Yeah, I mean, I think there's a huge job to do in terms of the organisational culture, and the reports that I referenced all talk about that it's not just one element. So having highly skilled and students who can look after themselves is grand, but the organisation needs to adjust and become more compassionate. And in another study I was involved with recently, where we sat in on board meetings, there were some moves towards this. So the board meetings all started with a patient story. So to try and get the board to centre on the needs of patients and what the whole organisation was there to do, the meeting was started with an account. It could be a complaint, it could be a positive, but really just to put the patient at the heart of it. Now, of course, then they do shift onto waiting times and financial stringencies and all the rest of it, but there were some efforts to try and do that. So yeah, there's a long way to go, and the pressures and the political context force people to behave in ways in which they wouldn't. You know, we create these environments that result in people practicing in ways that we wouldn't want, and patients don't get the care they need. And if we do it right, you know, clearly it has all the other benefits: patient outcomes, improved safety, because people feel they can raise issues, they'll be attended to because they're not going to be shouted down, they'll be listened to. So there's quite a way to go, but if we can get the combination of those things right, you know, the well-prepared, highly skilled, dedicated students, a supportive program to ease them from the transition, and an organisation that really is focused on the needs of patients and supporting staff, you know, we'll get there. And there are beacons of excellence. I mean, don't want to be this to be a sort of council of despair. There's a lot of great work that goes on, and we just need to keep pushing with that. And we hope that, you know, our insights on compassionate leadership, what it is and how it is working in some places, may be helpful in that respect.
Brilliant. Thank you. Excellent discussion. And very excitingly, Louise tells us that Maria's presentation will look at compassion from a student. The segue and the linking is just fabulous. Annie just has added on this subject to create workplaces where people want to work. High-performing organisations are often compassionate workplaces. Yeah, you're absolutely right. Brilliant. Okay, thank you very much.
Thank you, everyone.
Thank you. We will head to our last presentation. This is from Dr. Maria Pearson from the University of Nottingham, and it's pre-recorded, and she's going to talk about compassion, an exploration of student midwives' academic and clinical learning during their midwifery education. Thank you, Alejandro.
Well, a very good morning, everyone, and it's my real pleasure to be here today to talk to you about my research on educating about and for compassion in midwifery education. I'm Maria Pearson, and I'm one of the midwifery educators at the University of Nottingham in the professional group of midwifery. The research was part of an education doctorate, and I set one overarching research question for the research, and that was what and how do student midwives learn about compassion in an undergraduate midwifery course? And they were 3 sub-questions that built to answer that overarching research question, and I will revisit those as I go through the presentation. This became an important topic to explore, following on really from a number of high-profile reports in the UK that had suggested healthcare was lacking in compassion. And those charged with educating future healthcare professionals really needed to reconsider compassion, and it took on a renewed focus. And whilst there was a body of literature emerging from nursing and in medicine, midwifery were yet to inform that corpus of knowledge. And that presented me with an opportunity to consider compassion in midwifery education and make a contribution to knowledge. I adopted a mixed methods methodology, and the data collection was in 3 distinct separate phases, so phase 1, 2 and 3. Phase 1 comprised of 24 participants, and they were students that were brand new to our course in year 1 and week 1. And as yet had not been formally taught about compassion. And that's something at Nottingham that we do within the first module that students study. They will formally study about compassion as part of their first theoretical component. Phase 2 of the research was 81 participants in years 1, 2 and 3, and they completed a self-completion questionnaire. And then phase 3 were students from years 1, 2 and 3, and they were in separate focus groups, and I used semi-structured interviews. So what did I find from the analysis of the data that was collected? So if I return back to the overarching research question, what and how do student midwives learn about compassion in their undergraduate midwifery course? It appears that there are 3 distinct yet interrelated phases that support learning about and for compassion. And this starts with their life experiences, then the formal teaching about the ideas associated with being compassionate builds on students' existing experiences and perspectives, and then the formal teaching about compassion aims to get all students to a minimum understanding. And within midwifery education, we have a wide diversity of students with different life experiences, and therefore the teaching is really important to assist all to a minimum understanding of compassion by at least the end of their midwifery education. Clinical practice informs that learning through either the absence of what students perceive to be compassionate interactions or the presence of compassion in those that are supporting their learning in practice. So the sub-question that explored what student midwives understood about compassion prior to being formally taught about it was that, and this is probably not unsurprising actually, was that their understanding of compassion arises from their upbringings, their relationships with others, the formal schooling that they've undertaken, and for those that have had careers before they commence midwifery education, the work interactions. And this again asserts to the point of a diversity of students' experiences means that they will have very different perspectives about compassion, and they'll be at different starting points in their thinking. And so it's really important that the formal education about compassion comes really early within their education to get them to start to think about compassion. So in terms of how useful they found the study of compassion, it appeared to renegotiate for them their meanings of compassion and really started to help them build on their previous life experiences. And so teaching them early in the midwifery education supports them to know what compassion is, although we know it is a complex construct, and there are multiple definitions that support that claim. But being taught about compassion supported the students in knowing when compassion wasn't present in interactions, or their perspective on that in any case. So most students, those in the age range 25 to 64 in the study, said that the formal teaching had changed their understanding about compassion. And so that supports that we should teach about compassion in midwifery education. An interesting finding was that 12% of the 18 to 24-year-olds said that the formal study had not changed their understanding about compassion. And because that data was elicited using a self-completion questionnaire, there is no opportunity to go back and to delve into why that might have been. And so that's considered a limitation of the research. So theory and practice both inform learning about compassion in midwifery education. And that that links nicely into this next question that asked, how did working in clinical practice influence the students? And it was really very clear that the formal teaching about compassion had helped students to see the presence or absence in interactions with women and their mentors. And it really supported the idea of the midwife that they aspired to be in the future. And so role modeling is a real significant aspect of compassion and the learning of the value. As I said previously, compassion is a complex construct. It's often associated with other ideas, such as sympathy, such as empathy. But as part of the analysis for the research, I used a theoretical framework, and I used Wenger's communities of practice. And if you've not come across that theory before, it asserts that learning is socially constructed, and that really fit well with midwifery education, where theory and practice are inextricably linked. And so what it appeared to do for students in terms of the taught theory and then going into practice, it helped with reification of compassion. And Wenger describes this as turning something abstract into something concrete. So they were able to know compassion when they saw it, and also when it was absent. So I see that the formal teaching is absolutely essential for the reification of compassion. I will leave the presentation there, and thank you very much for listening, and I would be more than happy to take questions in the session that follows. Thank you.
That's fantastic. Thank you. I'm aware Maria's not here, but we do have Louise. There she is. So if there are any questions, I mean, again, unless you wanted to sort of add anything immediately, Louise, I was struck by sort of that role modeling again, but also I thought it was quite interesting around that sort of the idea around the absence of compassion. And when you've got some formal knowledge about it, whether having an understanding of the absence would, I don't know, inform your practice better or something. I don't know. What do you think?
Yeah, I think you're right. I'll just say Maria's really sorry she can't be with everybody today, but she has had an accident, and that's why she's not here. She would have been here, and she's badly hurt her eye and she can't see. She went, well, I could do it with one eye. I went, no, you can't go on screen with one eye. You've got to rest your eye. So that's why she isn't here. But she has been very much driven our compassion element in our curriculum and through the research that she's done. And that's really heightened, I think, not only the students but also the staff, us as academics who teach alongside her, of picking up this compassion and how important it is. So it then becomes a thread, although it's part of one of our first modules, it actually then becomes a thread through all of the other modules, so that it always comes back and we're addressing compassion. But I think, yeah, the role modeling, it was stark, and to use your name, also how that once they know about compassion and they start to be able to identify what it is, that they can identify when it's not there.
Very interesting. Thank you, Louise. Gigi.
No, thank you, Louise, and that was a great presentation. I was really interested when you say teach the principles, teach the concept, because that's what we quite often do, and we teach the theory. And the theory helps somehow the application of this in the clinical setting. We did a study with Professor Nathan Constantine. We looked at nurses and doctors and look at their compassion level and what actually increases nurses' compassion. And this is where I coined the word self-compassion. Is it a bad thing? And what they actually found in the study is that self-compassion seemed to be practiced by many nurses to maintain compassion. And they don't do it because they're nasty, but they use it as a defense. And so when you're talking about a formal skills being taught in an environment like healthcare, something like teaching the skills, even we quite often use communication skills, but is it communication skills or is it understanding human utterances, you know, why people respond that way when they're stressed, for example. So when they see their patient shouting at them, in comes the principle of how to manage human encounter with someone under a lot of stress. So I'm interested from that perspective in terms of how do you actually teach it? How do you incorporate it? Because it's the same for any curriculum, postgraduate as well. I teach therapeutics, and you know, prescribers need to have that, need to understand how else, because that will make the patient better, isn't it? So I was interesting from that point of view.
Well, Annie actually suggests, would an outcome from this group be a piece of work around scoping of a core curriculum or a toolkit for compassion in the curriculum? Certainly some of the things that people have talked about today, we could probably do that quite easily. Lorna has added a toolkit would be useful, especially linking compassion to other skills and topics so it can be embedded in curriculum, as Maria alluded to. Yeah, I think we could definitely at least maybe look at what we are doing.
Yeah, what's already existing in the curriculum and how and where the gaps are would be really good, you know, because I'm sure we're already doing it. But exactly. What is it that's lacking, you know, how do we make it better for our students? And then hopefully they will become leaders one day and they will have that sort of skill, you know, quality without even thinking twice about it.
Louise also adds that it would be a great initiative following COVID. It would be a very positive thing to be focusing on and sharing good practice. Okay, we've given ourselves jobs, people. I like it. Okay.
Can I just add, Julia, that it fits with the early career stuff as well. That the thing that people were talking about, one of the things that struck me, one of the things I've heard from early career nurses, is the lack of compassion towards them by senior nurses. So that that whole thing around how do you get nurses who are senior and who are responsible for supporting younger nurses to feel compassionate to those nurses? And there's a clear difference to me. I haven't got the evidence, but it looks to me like between those nurses who experience senior nurses who really look after them and those nurses who feel like they're belittled by their senior nurses. And so it's not just compassion towards patients, and it's not just self-compassion, it's compassion for anyone who you're working with, basically.
And how does that link with burnout?
Oh, absolutely. And how does that link with the schools of education? Even, you know, like schools of nursing who are dealing with staff in the hospitals who are then going to deal with their students. And so is that brought up in part of the teaching of supervisors and the clinical supervisors, etc.
Lorna adds, nurses eat their young. Anything that changes and challenges that rhetoric is welcome. I completely agree. The sad thing is that you keep on hearing it, you know.
Still, I know it is very sad. I mean, I always think that surely nurses who didn't start their nursing training being horrible people who wanted to hurt people. So what's happened to some of these senior nurses or supervising nurses who have lost their compassion, really? And so it would be because they weren't treated with compassion either. They were burnt out and done over. So somehow we have to. I think it's a great word, actually, because it's not too jargony, if you like. It's got a common person meaning as well. And so it could be very useful as part of the lexicon for talking to nurses at all levels. Is your organisation compassionate to its nurses? Are your senior nurses compassionate to their students and student nurses? That's quite a good question, possibly.
Thank you, Stephen. Excellent discussion. We've got Nomathemba has said, our students attending practicals in the teaching hospital often have this to say as part of the post-conference. It's like we are not wanted on the wards.
Yeah, that's right.
Yeah. It's funny because, you know, I trained at Charing Cross Hospital in London, and it was a real sort of honour to be able to have students, and we were regularly audited by local providers, and you know, it's a source of shame if you weren't allowed students. So you were actually very excited to have them and to do a good job and welcome them, because you know, you're a teaching hospital, and you know, without students, then it was sort of, you know, the quality of the care that you gave was almost, you know, affected by that. So it's changed somehow. Annie.
I was just going to say that we did something in the large trust that I'm connected to, which was called The Big Conversation, where we talked to students about what would make the workplace better and for them as students on their placements. And one of the biggest things was not to be referred to as the student, but referred to by name.
Wow.
Which I think is very interesting, that in effect, they would just constantly ask the student, tell the student, and had no personhood.
Mm-hmm. Do we put enough time and effort into that, you know, teaching the preceptor to be a good preceptor on a ward? Leslie Dowd,
sure.
Sorry.
I'm not sure if we do, but one of the strategies was to make sure they had badges that said my name is, and their name.
Yeah. So it's not just for the patients, it's for the registered nurses on the ward as well. Yeah, absolutely. Leslie talks about horizontal violence is still alive and well, despite new grad transition to practice programs, which are to support our new nurses in their first year of clinical practice, she says, breaking down the acronym, just need it to be the norm. Yeah, good point, Leslie. Louise adds to Annie, that also applies to the patient, the woman, rather than addressing them by name. Yeah. Or the room number, the bed number. Yeah. There's a lot of work to do. But I do think that, you know, a really good outcome of this meeting would for us all to look at what we do around maybe teaching, but also, you know, sort of, so maybe that formal teaching piece, like Maria's talked about, what do we do anything formally in our curriculums? But also, I think I love some of the ideas around the tools that people have come up with in mindful moment and all of that around sort of supporting compassion that comes through our programs. Is that something that we could put together?
I think so.
Yeah?
Mm-hmm.
Okay.
Very good. Yeah.
I will get onto that for sure. Believe it or not, time's nearly up. That's an hour and 50 minutes that's flown by. Fantastic presentations. All of them were so interesting and so well done. So thank you all very, very much. Is there anything people would like to bring up or talk about, or ideas for next year?
Do we know what bids have been funded that may involve nursing and midwifery yet?
Karina? People have they?
We have notified all funders, and the exec committee will go through that tonight at the exec committee meeting. All of the communications around that will probably come out next week, Annie, but we'll definitely share it with this group so that you're aware. Thank you.
Yeah. It's a really, really useful, the U21 funding is a very useful tool. And I certainly think tonight is a perfect example of the innovation and collaboration that comes from this network. I think what gives so much strength to a lot of these research projects is the breadth and the internationality that comes along with this network and with these studies. So I think it's fantastic. Just a couple of more comments. Rowena's adds, as nurses and midwives, we really need to be compassionate and continue to be role models in providing compassionate care. We do really have a long way to go in terms of compassion. We do. But I just
thank you,
feel
Julia,
like this is
for all the work that you have put on this meeting. It has been a wonderful meeting, so thank you very much, and particularly thank you for your leadership.
Oh, thank you, Lily. It's very kind. Thank you. It's an absolute joy working with all of you throughout the year, and this is the real highlight of my year. I want to say a huge thank you to the presenters for taking the time to come together, put a presentation together, and taking the time out tonight to come and share your work with all of us. I'm very, very grateful. We could never hold any of these meetings without the great support from our project manager, Karina. You are an absolute pleasure and a joy to work with, and it's really important that you're acknowledged every time we meet, but particularly during the annual meeting, because I know it's intense. So we really appreciate your support for nursing and midwifery, because you're always here, and I really appreciate it. And also finally, a huge thank you to Alejandro for doing such a wonderful job of getting the presentations to work and making me feel very calm from that perspective as well. So thank you very, very much. And if everybody is happy, we shall close. But it is fantastic to see you all. And there'll be a video played on the last day of the U21 meeting. But fingers crossed, it's coming to New Zealand next year. So hopefully, you never know, we might even all be in the same room. But might be, yeah, I know, might be wishing a little bit too much for that. But thank you for all the wonderful comments and for your enthusiasm and contribution. It's great to see you all, and so many of you. Okay, ka kite anō. See you again soon. Take care. Kia ora.
Bye.
Fantastic. Thank you. Great presentation. Thank you. Went really well. Went really well.
Really good turnout as well. So well done. That was really, I couldn't believe how many people. That was a lot more than, well, when we did it last year, you split it into two, didn't you? And I think the European version, there was only kind of a handful of people. So this year you've had about 30. Really
the right number
31.
32 people.
32.
I think, yeah.
In total, I mean.
Yeah.
No, I think really good conversations, Julia. Really good. There was no silence. Everybody wanted to get involved. So that's really
amazing.
And I've asked Alejandro if